Thank you, Dr. Noorhasan, for joining us again. And I really appreciated all the information you shared with us last time about basics of infertility and the causes. And I would love to hear about different treatment options for infertility. So people who are looking for answers can at least have some idea on how they can find help. Before we go into today's interview, I would like to add a disclaimer that anything we discuss during this interview is for general information purpose only. It's not medical advice for one particular person. And if anybody watching this interview is considering getting treatment, please consult a medical provider and get professional guidance, and make sure you have professional care that you deserve. So Dr. Noorhasan, can you please discuss treatment options with us for infertility and how people can find help?
Yes, absolutely, Tulsi. We had so many great questions after our interview last week regarding the causes of infertility. So today we're going to talk about treatment options for fertility. And there's a wide spectrum of fertility treatment options. The simplest one is just having timed intercourse, figuring out when you're ovulating and have intercourse at that time frame. There are ovulation predictor kits that you can buy over the counter. And what you would do is check your urine first thing in the morning to see when you're ovulating. And that tells you when the window is correct for having intercourse to conceive. Now, ovulation predictor kits work best in women who have very regular, predictable cycles, and therefore most likely are ovulating. Another form of treatment that's incredibly simple is utilizing pills. Clomiphene citrate or letrozole are simple pills that you can take that help you produce a follicle. Follicle are like sacs within the ovary that contain, and each one contain an egg. So these medications help you to produce the follicle containing the egg, and then you will ultimately ovulate the follicle, whether you ovulate it on your own or you take a trigger shot to ovulate it. And then you time that ovulation with when you would have intercourse, or do an insemination. So instead of having intercourse, you could do what's called intrauterine insemination, sometimes called artificial insemination. Mm-hmm. And what it means is that we get the sperm sample from the male partner, we wash it, we spin it down, and we inject it directly into the uterus. With an intrauterine insemination, that helps us a little bit more than just timed intercourse. Because then there's two real reasons for that. One, we're putting the sperm directly into the uterus, and so therefore bypassing the cervical mucus, where a lot of times the sperm can get trapped in the cervical mucus. And the other reason that intrauterine inseminations work well is that now the sperm has a shorter distance to swim to the egg when it's in the uterus or starting off in the uterus compared to when it's starting off in the vagina. So intrauterine inseminations can be combined with pills like clomiphene citrate or letrozole. And also intrauterine inseminations can also be combined with an actual cycle instead of timed intercourse. Intrauterine inseminations could also be combined with another form of ovulation induction, and these are injectable medications. So instead of taking pills to make you ovulate, we would give you injections. Some women do require injections instead of the pills, and your doctor can tell you which one's best for you.
And that would be an infertility specialist?
Yes, so a reproductive endocrinologist and infertility specialist, that's correct, someone like myself. These forms of treatment, so whether it's clomiphene citrate or injectable medications combined with insemination, though your chances, on average, your chances of getting pregnant per cycle with these forms of treatment are about 10 to 20%. Now you got to remember, everyone's different, so everyone's going to have a different prognosis or different chances of getting pregnant, but on average, 10 to 20%. Now, in vitro fertilization, that's very different. With in vitro fertilization, what happens is the woman takes injectable medications, but instead of doing insemination, what happens is we take the eggs out, the male partner gives us a sample, we fertilize the eggs with the sperm to create the embryos, and then later down the road, we can transfer the embryos. Now, prior to transferring the embryos, if a couple wishes, they can do genetic testing of the embryos, and that's called pre-implantation genetic testing aneuploidy screening, PGTA. And what we're doing is we're assessing the embryo to see if it's euploid, meaning having the correct number of chromosomes, or aneuploid, meaning having the incorrect number of chromosomes or gene regions. So euploid embryos are more likely to implant and result in a normal pregnancy. Aneuploid embryos are less likely to implant and result in a normal pregnancy. So what happens is once the embryos grow to the blastocyst stage, which is about 5 to 7 days after the egg retrieval, the embryologist will biopsy the blastocyst, and that's the stage of the embryo, just taking a few cells off the what's called the trophectoderm. The trophectoderm would eventually become the placenta. So we're not taking cells off the actual parts, which would become the fetus and ultimately the baby. We're taking cells off the trophectoderm. We take those cells off and then we freeze the embryo. The embryo stays frozen in the facility, and then the cells that we take off, we send them off for the genetic testing, the PGTA. If a couple, for example, if the male partner and the female partner are both carriers for certain what's called recessive disorders, meaning they carry the gene but do not have the disease, but if they both carry the gene, they have about a 25% chance of having a child with the actual full-blown disease. So we can do pre-implantation genetic testing, screening called PGTM of the embryos, and that will test the embryo for that specific gene. So, for example, if cystic fibrosis is both the husband and wife carry the gene for cystic fibrosis, we can test the embryos for the cystic fibrosis prior to transfer. So that's called PGTM. And the M is monogenic, so it's targeting a specific gene. And then ultimately the embryos are transferred, and that's typically a frozen embryo transfer. The Infertility Society as a whole has moved towards frozen embryo transfers. We see higher pregnancy success rates with frozen transfers when compared to a fresh transfer. And a fresh transfer would typically occur a few days after retrieval, whereas a frozen transfer, the embryos are frozen. We wait for genetic testing of the embryos if that's desired by the couple, and then ultimately transfer the embryo.
So that seems like people have a lot of different options that based on their situation, you can guide them which route to take.
Yeah, exactly. And you know, the interesting thing, when we can get a good euploid embryo and transfer that embryo to a normal uterus, we're talking incredibly high chances of getting pregnant, 60 to 80%. And when you think about 60 to 80% chance of getting pregnant versus 10 to 20% with IUI, that's why many couples will probably pursue IVF. It's the shortest, fastest route to getting pregnant.
Yeah, and less frustration or
Yes,
disappointments.
exactly. Less frustration, less, getting your period every month and being depressed about it. You go straight to
the whole anxiety of is it happening or not happening. Yeah.
Exactly.
Yeah. So you talked about frozen embryos, and I think there are a lot of women who may not want to, with education and responsibilities and career and ambitions and different reasons. Not a lot of people are ready to have kids early in their 20s or early 30s, and some women are not in a relationship and they may still want a child later on with the right person. So can you talk to us about freezing their eggs, or what are their options if they are not ready but they don't want to eventually deal with infertility?
Egg freezing is such a great option for women today. 20, 30 years ago, women had to choose, do I get married early on and start my family, or do I pursue that career that I wanted to do, travel the world, and then finally, when I feel like I've met the right person, then start a family, but then many times struggle with fertility. Now, egg freezing really allows women the opportunity to have the option for both. Essentially, they can freeze their eggs when they're younger, and if they need it later on down the road, those eggs are available for fertilization and forming an embryo. And if they don't need it, maybe there may not have been a person that would have struggled with fertility. It was at least peace of mind for freezing their eggs. If I would highly recommend women in their 20s and early 30s to freeze their eggs.
Yeah, especially early 30s, if they know they're not anywhere close to having a child or having being in a relationship where they want to have a child. I think it would be a smart idea to freeze the eggs so that when it's the right time for them for their relationship, they can still have increase their chances of having their own baby. um,
Absolutely.
um, some people may not understand what happens when they freeze their egg. Does the egg quality stays the same, or does it change? And if you can tell us a bit more about that.
hmm Absolutely. So the egg freezing process has improved significantly in the last several years. Initially, we were doing what's called slow freezing, and that was allowing ice particles to build up in the egg, and the method of freezing was not the best. Now there's vitrification, which is rapid, fast freezing of the eggs. You don't have buildup of ice particles in the eggs. So the freezing technique is as optimal as we can have it at this time frame. And in 10, 20 years, there may be better technology.
Advanced. Yeah.
Um, and, so going back to your question, no, so the quality of the eggs when we thaw them are based on the quality of the eggs going into the freezing process. So the higher a woman's quantity and quality of eggs going into the freezing process, the better her chances of getting good quantity of high quality eggs once they're
Okay. So I guess 20s would be the best
thawed.
time to freeze it.
I have some patients in their 30s freezing eggs in mid to late 30s. The thing is, everyone's so different.
Yeah.
But there are women, even though our egg reserve or egg quantity quality declines with age, there are women who have fantastic egg reserves in their mid to late 30s and some in their 40s. So everyone's so different. So what I would suggest is um, contact a medical provider, your reproductive endocrinologist and infertility specialist in your area, and just go get tested. Just figure out how many eggs, what is my egg reserve, egg quantity, quality? Should I freeze my eggs or should I just wait and see if I can get pregnant at some point in the near future? That's a good question to ask your local provider once you've done the testing for egg quantity, quality.
Thank you so much, Dr. Noorhasan, for sharing this valuable information with us, because I think this is such a super specialty. Also, there is so much stigma attached when people find out that they have difficulty conceiving, and it's an emotional struggle. And then if they don't know how to navigate the medical system, it people waste a lot of time that could be used uh, towards treatment. So hopefully this will give hope and resources to people on how to navigate infertility and how to still increase their chances of having baby. Now I know you have had your own struggles, and I personally know your story, but I would love for you to share that with our viewers. It can empower the women who are suffering and struggling through the same situation.
Yeah, absolutely. So my family were immigrants, and I spent a long time in schooling, learning how to become a doctor. And so finally, when I got out from, college, medical school, residency, fellowship, I found myself already in my mid 30s. I waited a few years and didn't meet the right person, and so I decided to freeze eggs. And I didn't have many eggs because I was a little bit older at that point. And then I really wanted to be a parent, and so I tried with donor sperm and two negative pregnancy tests, and then ultimately I met my husband, and both of us together also needed IVF. So he had some issues, I have my issues. Long story short is I did 5 rounds of um, IVF. So 5 rounds of taking the injections, 5 egg retrievals. And out of that entire process, I got one euploid embryo. So we talked about the genetic testing of the embryos. I only had one normal one out of that whole process. And, I did this in my very, very late 30s, and my egg quantity quality was incredibly low at that point in time. Ultimately, that embryo was transferred to a surrogate, And it's only because of my surrogate's kindness that I'm a mother today. So I understand what my patients go through because I've gone through all of it. I've gone through the negative cycles after cycle after cycle that's negative and negative. And I totally get where they're coming from with this whole process. And so I actually wrote a book about my story because I wanted to share my story with the world. What I found is by sharing our stories, we're making the topic more understandable to others and sharing our experiences, and we're making the topic less taboo. And so the book that I wrote, it's called, I'll show it to you here. It's called
Yeah.
Miracle Baby, A Fertility Doctor's Fight for Motherhood. And it's my story about having my son. But you'll see there's a second parallel story in this book. And the second parallel story in the book talks about my personal life story of a child whose family were immigrants, and learning my way around and ultimately being accepted into medical school and to achieving success. So it's a story of hope, faith, certainly perseverance. You'll see the
Yeah.
multiple tragedies I've gone through, and a story of love. So I hope readers enjoy it, and I hope that it gives them inspiration to pursue fertility or even pursue anything that they're thinking of pursuing.
I know you have another book too, so why don't you tell us about your second book? And people who are interested in reading your books, they can go on Amazon, I assume, and buy them.
Yeah, so Amazon and Barnes and Nobles, and
Okay.
you can also find them on my website, www.noorhasan.com. So just my last name.com. But here's my second book. This book is called The Fertility Manual, Reproductive Options for Your Family. And it's a short, less than 100 pages book. What I've seen over the years is that the information I present to patients can be incredibly overwhelming. And what I wanted to do was write a short, quick, easy book that just gives you the nuts and bolts. What is fertility? How do you know you have it? What are your options to get pregnant? I talk a lot about the treatment options, which we just mentioned, but I also talk about donor egg, donor sperm, and surrogacy, because sometimes you have to borrow an egg, a sperm, or a uterus, as in my case.
Yeah.
I talk a lot about the psychological component because there is a lot of stress, anxiety, and depression surrounding fertility. And you know, it's interesting, and I mentioned this earlier in the month, is that I let my husband read the first draft of both books, and when he read the first draft of that second book, he said to me, "Well, I wish I had this book before we went through all of those treatments, because here he is, he's married to a fertility doctor. He can just ask me any question anytime." But he felt like if he had some basic knowledge of
Understanding.
and understanding exactly of what fertility is, he would have been able to ask the right questions, because sometimes he didn't even know what the right questions were to ask.
Yeah, I agree. I agree. Sometimes online information is so variable, complex, and not even correct information at times. And a book written by a doctor who is already practicing and trained in this particular specialty is much more reliable and legit. So I would share your link under this video, so that way anybody who is interested in learning about it and understanding why they are going through what they are going through and what their options are, I think your book would be a huge valuable resource for them. So thank you so much for sharing all that information with us, and I hope it helps a lot of people in the long run.
Wonderful. Thank you for having me, Tulsi.
Thank you.